David, would you like to tell us something about how social care is changing in Nottinghamshire?
Well, of course, we've just had the implementation of the most major change in legislation for social care in 65 years in this country, in the Care Act, which does describe how the future of social care could be and what people can expect. So that includes very good advice and information that will be required. Trying to prevent or delay the need for people to have care and support by helping people to maintain their independence and their well-being. It actually describes the need to maintain people's well-being. And then the legislation also sets national eligibility criteria. In other words, who can be entitled to social care services and what might they involve. For the first time, it will also mean that carers, informal carers, family carers, can get services as well as have an assessment. So quite some big changes, Alan, and quite important ones, and will have a major impact on care in Nottinghamshire.
Wellbeing to me means living life to the full. It means living in the here and now.
Wellbeing to me is making sure my baby Logan, who's due in October, is fed and rested, lots of fluids, just making sure everything's all right.
Wellbeing for me means the feel-good factor, ensuring that when I get up in the morning, I know that my day is going to be enjoyable.
Wellbeing to me means that my family are happy and secure.
Wellbeing means, 1, get my own place, 2, maybe meet someone and get married.
It's about being loved and loving people and feeling cherished as a person.
Wellbeing is Ben & Jerry's fish food ice cream.
Wellbeing to me means that I come to work, I enjoy my work, I achieve for vulnerable people a lot of support, and I go home and enjoy my own life, and especially my grandchildren.
Well-being is being able to communicate and talk with friends, have a laugh, a joke, and maybe share a beer between two of us.
It's about being able to achieve the things that you want to achieve in life.
Wellbeing is creating a masterpiece, a fantastic painting that I'm really proud of.
Wellbeing is looking after your money so that you can enjoy all the things you want to do.
Wellbeing to me is time with my 2 lovely children, enjoying sunny days.
Wellbeing is for everyone, whoever we are,
and whatever our circumstances.
Keeping as well as we can be
will help us carry on doing
what we want for longer.
This film will show adults and carers how to get support. You can get support from a variety of places, including voluntary organisations and the council.
The Dementia Cafe in Mansfield has just grown and grown. It's fantastic that people can come, they can bring their loved ones with them. Today we've done a night at the proms. I think we've also done a cartoon quiz, so it's just something to provoke memories, have a bit of fun. We do give expert advice to carers. We can refer on to the Department of Work and Pensions, to county councils, to social services for a carers assessment or a needs assessment for the person with dementia.
We have a new carers hub that provides advice, support and training, and provides services such as the emergency carers card. Carers can expect an assessment to look at what their needs are and their circumstances, and if they're eligible, a personal budget allocation. This is a one-off payment to support them as a carer. For carers who are supporting loved ones at the end of their lives, we have specialist services to support them. And for carers who are close to breaking point, we have crisis prevention services.
The first carers assessment was done face-to-face. The second carers assessment was done a little bit later by her then social worker, who saw the plight that both my mum was in and my care, because she could see that I was at the end of my tether. and she said, what you need is a carer's assessment for just something to boost your well-being. Yes, I would consider doing it online.
A carer's needs meet the eligibility criteria if the needs arise as a consequence of providing necessary care for an adult. As a consequence of the following, there is, or is likely to be, a significant impact on the carer's well-being. They are unable to achieve any of these outcomes. Outcomes are unobtainable if the carer's physical or mental health is or is at risk of deteriorating. Carrying out any caring responsibilities the carer has for a child. Providing care to other persons for whom the carer provides care. Maintaining a habitable home environment in the carer's home, whether or not this is also the home of the adult needing care. Managing and maintaining nutrition. Developing and maintaining family or other personal relationships. Engaging in work, training, education or volunteering. Making use of necessary facilities or services in the local community, including recreational facilities or services, and engaging in them. Often we see people as a service user or a client that needs support. Meet Bob. Things that have been said and recorded about Bob by the staff that support him are: he's frail, has possible onset of dementia and is getting very confused. Struggles to mobilise, needs support with personal care as he's sometimes incontinent. Forgets to change his clothes, can be verbally challenging, hard of hearing. Although these terms describe some of the things Bob may find difficult, they don't really describe Bob the person. Bob can also be described as a husband, a father, a grandfather, an uncle. A highly skilled engineer who used to make engines for Concorde. A clever man who once appeared on Mastermind. A lifelong Notts County supporter. A scorer at his local cricket club. A gardener who had an allotment for 20 years and was well known for growing veg in the village. A great storyteller. A regular at the Fox and Crown pub. If we begin by looking at these strengths, interests, qualities and connections, we start to think about how we can use these to support Bob in a way that maintains his independence, builds on what he's able to do for himself, and most importantly, provides support that makes sense and works for him. Take a minute to think about someone you support. Who do you see?
We're discussing things I'd like to do for the future and things I'd like to build on. I think Charles picked up on some of my inner strengths and my weak points, helped me with my weak points and built upon the strength and the things that I did have going for me.
It's made Julie feel like a person, actually knows that I'm there to help her and not help the problem that she's got. So it has built up her confidence to be able to know that she can go and do her shopping.
I can pay all the bills. I've lost half a stone in weight over the last few weeks by going swimming.
The strength-based approach that we are taking enables Julie to make sure she's got them links with her family and the neighbours especially. So if Julie does feel that she's having a bad day, or if something happens in Julie's life where she would need some more support from people, rather than her having to call the emergency services or calling some crisis team, she now has them connections and the confidence to be able to pick up a phone, to speak to a family member, to pop round to the neighbours, to gain that help from them before it gets to that crisis point.
I knew I'd be able to cope, and I knew I had that organisation to fall back on if anything did go wrong.
What is a support plan? The purpose of a support plan is to agree how a person's needs are going to be met. Meeting needs is an important concept under the Care Act, as it moves us away from the idea of simply providing services. A person's needs are specific to them, and there are many ways in which they can be met, for example through community or informal support, assistive technology, or traditional services. This shift enables a more creative approach to support planning, one that focuses on the individual and the direction they want their life to take, rather than the provision of existing services.
Care and comfort have helped individuals to meet their outcomes, and one gentleman in particular, he'd spent most of his life sort of breeding dogs, and in the latter years he'd been looking after his wife, who unfortunately went into a care home and then passed away. Unfortunately, very shortly afterwards he had a heart attack and a stroke, and he was referred to us by social services. When we initially went to see him, it was quite clear that really what he wanted was to make a life for himself, not really be stuck at home. He'd been quite an active man, obviously walking his dogs, and one thing we found out that he used to like to do was cycle. He had a cycle in the shed, and our male support worker went along, took his own bike and went along, mended this client's bike, the service user's bike, and they started going simple places, really, places where there wasn't any traffic, to try and build his confidence. And then they took the bike into Newark and went down the towpath. And then he was taken on the road, just very short distances to start with. And then obviously they became longer and longer distances. So that wasn't just about his mental health and well-being, that was also about his physical health and well-being, and enabling him to lead an independent life again. Our volunteers have the opportunity to attend the same training sessions as the paid workers. Most of our volunteers are on the befriending side of the service, so they actually visit people whose mobility is poor and really they are housebound. But our oldest volunteer is 90. He actually visits 3 people younger than himself. He's a really great chap, and he does enjoy what he does.
Information is everywhere, but this can make finding what you want difficult. Where should you go? And which information should you trust? There are lots of ways to get good information and advice. For example, the Citizens Advice Bureau, local community groups, or charities. Nottinghamshire County Council has worked together with other organisations to develop an online directory. It is called Nottinghamshire Help Yourself and can be found at www.notshelpyourself.org.uk. It provides information and advice about a wide range of activities and services, from leisure to checker trade to support to live at home. Accessing good information and advice at the right time can help people get the support they need and help prevent a difficult situation from developing into a crisis. Dave is currently in temporary accommodation and needs to find out about his options for housing. He doesn't have access to a computer at home, so goes to the library to get the information. This is his story.
Today we had Dave come in. He was wanting help with housing and his hobbies and interests, and we got him up onto the PC and we went on to the Nots Help Yourself website, home and housing.
Yeah.
Okay, let's look into this one for you.
We've been commissioned by Nottinghamshire County Council to provide a financial information and advice service, and what that does is help people access information and financial advice in a timely manner so that they can make an appropriate choice for them about their future care needs, estate planning, inheritance planning and a whole raft of other things. That can help reduce worry in later life. It can help reduce the anxiety of a family member, maybe for somebody who is becoming increasingly frail or has increasing care needs. And it essentially means that people are in charge of their own lives in terms of their care needs.
Hello, I'm Kath Moore. I work at Mansfield District Council and I'm helping Kingsmill Hospital with their hospital discharge scheme. Assist is a holistic approach that we've developed that can assist people who are in need. It's the assist model because we respond immediately to people's requests, whether it be the referrer or the person that's going to be referred to us. We try and identify suitable accommodation in an area that may be close to the family networks or other support networks that they may have. We identify a property and we fast-tracked for that accommodation for that person. We try and make them as comfortable as possible.
Social workers and whatnot thought that it'd be better if we got a place on a level like this, or pretty much level. So you're not lifting, you're not going from one step to another. It's run by Mansfield District Council as a sort of halfway house between hospital and getting a place that would be better.
I love going into the meetings, I love sitting with your nurses, I love them asking us questions. Could you help us with this? If it's about a toilet raiser, then an OT will go out. If it's about an OT going out and seeing that the person's in crisis, they'll ask the CPN to go out. If it's a CPN that goes out and notices an ulcer on the leg, they'll ask the nurse to go out. So it's addressing that need at that time and getting it done before it goes into crisis.
Integrated care allows me to give the service that I would like to give, and it's brought more people stability in their lives and a better environment to live.
Not be fearful to give it a go, to take somebody on who wants to have a direct payment in place. They are coming, they are going to be a big part of the future. I feel they're going to be growing. People in the community are taking them more and more, and those people that are in the community now will be wanting to transfer their direct payment into full-time long-term care as and when the need might arise. I do actually think they're a real opportunity to be offering people properly bespoke care that's right for them, and also not to worry about the extra cost. I think there is a fear that actually direct payments mean that we will have to split down our costs, show where everything is, take budgets out of one area to put into another to satisfy this person's requirement in this. But actually, when you talk to people, they don't necessarily want those big things that are going to cost a lot of money. They don't want trips to bingo every single week. They might like it occasionally, but it's looking outside of what is there and looking at the community, how they can help you. There's plenty of things that go off in local communities that would be a benefit to your residents, that would satisfy a lot of what people actually want. Your staff are a really good asset. You look at their skills and their knowledge and what they can do and match them up with certain residents and achieve outcomes that way. If somebody does take on a direct payment, it is more transparent on where the money is spent and how it's spent, rather than money comes from County Hall straight to the care provider. Family have little or no idea whether it gets increased, decreased or whatever. Whereas if it's coming straight to them, they know what they're getting and where that money goes then to.